Hey guys, welcome back to the World Parkinson Congress. Day 2 has just been crazy, packed full of awesome information that I'm really excited to share with you guys. I thought day 1 was good. Actually, day 2 has been so valuable. I'm not even kidding you. So I know it's just 5:30 and people are rolling in, but I was so overwhelmed by the amount of information today by some amazing speakers. We've got deep brain stimulation, we've got nutrition in Parkinson's, some really, really awesome information in there, so stick around for that. And then depression and anxiety and non-pharmaceutical ways to treat depression and anxiety. Of course, you know, if you've been around for a couple of these live broadcasts or you follow along with me at all in my blogs, you know I'm a really big proponent of letting the body heal itself and using medication as a supplement. And so all day long today, with nutrition and the depression talk and everything else, it was just a really big feeling of there's so much you can do beyond medication. And then the deep brain stimulation was just a great talk and discussion about the future of DBS and everything that the future holds for So I'm really excited, and I'm actually sitting on the floor in a quiet hallway here to make sure that I could hear you guys, and I hope I have enough juice in my phone to get us through. So if you're just tuning in and this is maybe your first live broadcast, my name is Sarah King. I'm a physical therapist. I'm specialized in Parkinson's. My practice is wonderfully specialized in helping people with Parkinson's get back on track, make a plan, and get their life back. I'm located in Austin, Texas, but if you're not in Austin, that's okay. You can still say hi in the comments here and check in. So I see Sharon's joining us. Hi, Sharon and Patty. You guys are awesome. Thanks for coming back. I know you were here yesterday, too. So I see people still streaming in here, but I'm going to go ahead and jump into deep brain stimulation. Before I got on the call here, I took a little survey, and some of you guys voted on what you wanted to hear about first, and DBS and nutrition tied. So since I learned about DBS first, let's just dive in. So deep brain stimulation is a fascinating science, and it's been really helpful for so many clients and so many people, at least in the United States, and that I've talked to. And today we really discussed who's a good candidate for deep brain stimulation, who would have the best outcomes, and then what the future holds for deep brain stimulation. So if you have had deep brain stimulation or you're considering it, even if you have it or haven't had it, I'm going to share some really great tips with you to let you know if maybe your deep brain stimulation is working as best it could, or maybe you're hoping to get deep brain stimulation, but you're not sure if it'll really benefit you. So more people are checking in here. I've got to recognize Mark and Cheryl and Kathleen. Oh, Kathleen from Napa. I could totally use a glass of wine right now while we do this talk. It's good for you. Okay, and your brain. So deep brain stimulation. We started with Helen Mayberg, and she was talking about targeting different areas in your brain. And the area 25 is where a lot of our targets for deep brain stimulation have been to help treat depression, actually. And deep brain stimulation has been really effective for those who are treated or who are getting treated for depression. 60 to 80% response rate, actually, for treatment-resistant depression. So they had been non-respondent to other medications in the past, but they did deep brain stimulation, and they hit the right circuits in the brain, and the whole world opened up to them. So if you have had deep brain stimulation and something I'm saying resonates with you, just hit a thumbs up or shoot me a comment. I'd love to hear your feedback on it. But what the newest discovery for deep brain stimulation is actually the way we think about deep brain stimulation right now is we go in and we try and pinpoint one really small area in your brain, either your substantia nigra or your globus pallidus. And we'll talk a little bit about why you target different areas coming up. But what they're finding is that it's more important to fire an entire circuit in your brain than it is to get on an exact pinpoint location. And so the future of deep brain stimulation will be looking into how we best activate an entire circuit in your brain instead of just that one tiny little part of it. And I'm going to talk about it a little later, and that might be why if you have had deep brain stimulation and it wasn't super effective for you, your deep brain stimulation might not be igniting your entire circuit of your brain. It might be working on that one small area, but for whatever reason, the way your brain is structured, it's not your surgeon's fault by any means, and that's not what I'm suggesting, but it might be that a different area of your brain needs to be stimulated to get your whole circuit in order, and those are the people who get the best outcomes. And so the people, I just wrote it down here, the people who are responding well to DBS actually have activation of the entire circuit, and that's called closed loop DBS. So you can go off and Google some of that, but be careful, of course. So the next person up with DBS was Andreas Lozano from the University of Toronto. And he gave a nice little picture of what symptoms actually improve the most from DBS, and then which ones are affected the least by DBS. So if you're considering DBS, listen up. Or if you've had it, you can give us your feedback. So the greatest impact of DBS is for people who have a lot of fluctuations in their motor symptoms. If they want to decrease the dyskinesia that's been induced by your levodopa, DBS also helps you increase your on time and decrease your off time. Those are the things that it's most effective for. Then, of course, it's really effective for tremor and moderately effective for rigidity, and then not incredibly effective for gait, including freezing or postural disturbances. So maybe you lose your balance to the right or to the left. DBS actually isn't that effective for, according to the studies, for gait and freezing. So if you're considering having DBS just for those reasons and not for the other ones that are included here, Dr. Oken put it nicely. He said it's not as effective if you're trying to work on walking, talking, or thinking. So keep that in mind if you're considering DBS, and we're going to talk a little bit more about it. Other symptoms that are less likely to respond to DBS include speech difficulties, cognitive function, sleep disturbances, bladder dysfunction, constipation, and sweating. So if those are your predominant symptoms, you probably won't respond well to DBS if you're even accepted to have DBS in the first place. So the way that doctors really predict if you are going to get a benefit from a deep brain stimulation is they do what's called a levodopa challenge test. And if you've had DBS, just give me a thumbs up if you've gone through this. But what they do is they take you off your medications overnight, and then they give you like a 1.5 dose of your medication the following day. And if you have had improved symptoms on that kind of increase in your levodopa, then you're probably going to benefit from deep brain stimulation, according to the speakers here. And if you are younger in age and you're having some of these symptoms that are improved by deep brain stimulation, then you're more likely to get a benefit than if you are a little older. They say that if you're over 70 and you have some type of cognitive impairment, even if it's mild, they're very hesitant to do deep brain stimulation on you, because if you're over 70 and you already have some mild cognitive impairments going on, then deep brain stimulation actually might exacerbate the cognitive impairments. And so you want to, obviously we want to avoid any of that happening. So if you're really confused about going through this DBS process and not really sure why someone's saying you shouldn't have it, those are kind of the reasons. And some people are turned down for DBS if they haven't been medically managed by medication quite yet. So if you haven't figured out your optimal medication dose yet, then DBS is a little bit a little bit too early to tell if you would benefit. You want to optimize your medications, and then if that's not working, then consider deep brain stimulation. If you're just not disabled enough, I know that sounds really strange, but if you're still getting around, you're not really impaired by your motor symptoms, they're not fluctuating a lot, you don't have a lot of on-off times, you want to hold off on DBS, at least according to the professionals here, because you kind of want to wait until you're starting to show some of those symptoms and medication maybe isn't as optimal as it could be, and then consider the DBS. And the last thing that Dr. Lozano talked about here was the new FDA approval of something called Focused Ultrasound Thalatomtomy. Just pardon me on that one. It's called FUS Thalatomtomy, and I can put it in the notes when we're finished here, but it actually is no incision brain surgery. So they put your head in this contraption and they do a focused ultrasound on certain parts of your brain, and it's new development for tremor. And actually it had really awesome results. So I'm not sure if it's in the United States yet, but I know they were talking about rolling it out in Canada. So I want you guys to keep your eyes open for that. If you're worried about the incision part, you're worried about the surgery, incision kind of going into your brain, then that might be something to focus on in the future. Okay. Hi, Bruce. Plus, I was put to sleep, so mine was awesome. Woke up and I was done. I know, Bruce, you said that you've had awesome results with DBS, so you are probably a responder. And, you know, some people have negative, this is actually going to feed into this last part about DBS, which is Dr. Michael Oken came up. He's done over like 1,500 DBS surgeries, or it could have been 15,000. But he's done a lot and he's written a lot of studies. And he was talking about predicting negative outcomes from deep brain stimulation, and what he really focused around was expectation. So oftentimes what happens is, and maybe you're part of this group, if you're considering DBS, you're looking at it as an answer to everything. You know, Bruce, you said you went under and you woke up and everything was great. Well, there may be people that go through DBS and they don't have as good of an experience, but they're expecting, you know, to wake up and be able to walk and talk and move, and, you know, life is going to be great and it's going to be, you know, everything fixed. And those people who had almost too high of expectations didn't do as well. But at the same time, if you had really low expectations or even negative expectations where you were convinced it was going to have a negative adverse reaction or something was going to go wrong, then actually that happened. So you want to have a positive yet realistic outlook about what deep brain stimulation is going to do for you. So it's going to help you better even keel your motor fluctuations. It probably is going to help you with your tremor. You're probably still going to have to go to physical therapy for your walking and your gait, although a lot of people have had improvements with those with deep brain stimulation. So it's not the answer, but it is part of the puzzle that if you want to use it, if you are indicated for it and your team thinks you're a go, then the future is looking bright for you. It's not nearly as risky as it used to be. But they did say that about 20% of people had adverse reactions to it, not like an infection or whatnot, but just maybe more dyskinesia, more depression, anxiety. And that was also, as I said before, kind of a byproduct of not activating an entire circuit in your brain. Someone just said, we lost you. Okay, Kathleen. Yeah, if you guys lost me, just let me know. If you can remember where I lost you, I can repeat some of what I said. But thanks for letting me know. Okay, so the next up, that was DBS. If y'all have any questions about deep brain stimulation, just put them in the comments and I'd be happy to answer them. If I learned about it today, I will share it with you. Okay, so up next is nutrition. And I cannot tell you how excited I was for this talk. To have nutrition and Parkinson's have an entire seminar at this conference, a World Parkinson Congress. Like, we are talking about nutrition for a reason. And, you know, there were a lot of great speakers here that really talked about the impact as food as medicine. And you swallow pills and you swallow food. So we can't expect anymore that those have different impacts. And the theme of today's seminar was nutrition. Does it really matter? And, you know, the response here was, well, you know, it's like saying oxygen and Parkinson's. Like, does breathing really matter? Of course, what you eat matters. And so I'm going to talk to you a little bit about the 3 speakers that came in today. And the first one was, well, what I want to clear up before I start this, I realized that if you've been following me for a while, I've been using ketogenic and plant-based diet really interchangeably. And I learned today that Ketogenic and Parkinson's is actually an entire protocol that I didn't realize was a protocol. So I wanted to really clear up what I'm talking about when I'm talking about a ketogenic diet from my eyes. Ketogenic just means predominantly fat-based. And when you eat a diet that's heavy in plants and fiber-dense foods, those foods are typically lower calories. And you're also adding in a lot of healthy fats from avocados, from olive oils. We're going to talk about this a little bit. But when you add in fats to your diet, those are more dense in calories. So a plant-based whole foods diet typically tends to be a little bit heavier fat from the calorie standpoint, but it's actually not from the volume of food that you're eating. The ketogenic kind of idea that I have in my practice is you're eating real plants, vegetables first. If you're my client, you know I say 6 to 9 cups of vegetables every single day. And you're eating healthy fats in combination with it, as well as 15 to 20% healthy protein sources. So we're going to get into that a little bit, but I wanted to clear up that you're eating a volume based, you're eating plants, you're eating things that come from the ground, whole foods, and then you are adding in healthy fats and really high quality protein if you decide to do the protein sources. So I will go ahead and get into this. So Matthew Brodsky, he was talking about the effects of Parkinson's therapy on nutrition. So instead of the effect of nutrition on Parkinson's, what happens with Parkinson's when you're diagnosed? What happens to your nutrition? So a lot of people actually are malnourished when it comes to Parkinson's. Levodopa can lead to a higher risk of malnutrition because you are not absorbing your nutrients as well as you should. So it interferes with your B12 uptake and other nutrient intake. And so you really want to make sure that your diet is really nutrient dense so that you can start to make up for some of these deficits that levodopa is causing. But it also did say that there's an increasing number of patients showing weight gain under dopamine replacement therapy or after surgery. So I know that someone had asked me, oh, interesting. Hi, Sharon. Did they mention weight gain after DBS? That's what I was just saying, actually. So some patients are reporting an increase in weight gain after DBS because of a change maybe in impulsive behaviors or a change in your fat metabolism. And so that definitely can happen, although the tendency is to lose weight when you're diagnosed with Parkinson's because you could be becoming malnourished if your diet isn't supplementing. And also if you have symptoms that are interfering with your ability to chew food, swallow food, you're taking pills all the time so you really don't feel like eating. There's a lot of things that come into play when it comes to malnutrition. So that's the effect of Parkinson's therapy on your nutrition. And then he was talking about the risk factors for Parkinson's based off of your diet. And there are 2 studies that were really strong that got called out at the very beginning, and they had to do with dairy and Parkinson's. So I'm not sure if some of you have heard of these studies. An increased intake of dairy and milk can lead to an increased risk for Parkinson's disease. I won't get into the details of those. If you want those studies, I can definitely link them up. But if your intake of dairy is above 16 ounces per day, which is just a cup or 2 of milk, you have a 1 to 2 time increased risk in Parkinson's, developing Parkinson's. So there's probably also, although the studies haven't been done, if you continue to drink milk and you have Parkinson's, if it increases your risk of Parkinson's, it's probably not really great for your Parkinson's symptoms going forward. They also talked about the deposits of pesticides from milk are found in your brain. 9 out of 10 people who are heavy milk drinkers, those pesticides deposit in your brain, and which is the last place we want toxins. So if you are a milk drinker, and you think that you're getting most of your calcium from milk, calcium from milk is actually really poorly absorbed, and there are foods, whole foods like spinach and nuts that have lots of calcium in them that are better sources of calcium because your body will absorb them. So no more using the milk gives me calcium excuse. It got called out here, so I gotta lay that one to rest. Okay, so that was Matthew Brodsky. We're gonna go into Heather Zwicky. She is a physician at, I couldn't tell you the nutrition school, a really awesome nutrition school. I got to shift my weight because my foot's falling asleep. I'm sorry. Okay. All right, we good to go? All right. So Heather Zwicky, her focus was talking about how we use food as medicine and what our goal should be for a diet for the Parkinson's brain. So our 3 goals for the Parkinson's diet. Number 1 is to increase the amount of brain food that you're eating. Number 2 is to decrease inflammation. And number 3 is to decrease chemicals. So by doing those 3 things, if we're focusing on high quality food, decreasing our inflammation, and getting rid of chemicals, those are the 3 best things that we can be doing to protect our brain. If you've been with me for a while, you should definitely know that sounds familiar, because that is the brain boosting kind of guidelines that I recommend to everyone. So why decrease inflammation? Well, in the short, when you have high inflammation from really low quality foods, a lot of toxins in your diet, that inflammation releases cytokines. And cytokines are your body's natural immune system response. They go and they fly in and they try and clean up the inflammation. Well, when your body has more cytokines, increased cytokines, those increase in cytokines trigger your brain to think, okay, I've got more cytokines, so I'm sick. So I need to start feeling malaise and fatigue, because then I'll stay in bed so I can heal. I'll, kind of maybe get depressed and anxious, and even hostile, so that, people who are around me won't come around me so I won't get them sick. Our body is raising our cytokines, and by raising our cytokines, it's making us feel like crud. And so when we eat foods that decrease that inflammation, bring our cytokines down, then we can clear away a lot of the malaise, a lot of the fatigue, some of the depression and anxiety, increase our energy levels because our body doesn't think we're sick and we need to lay in bed all day. So when it comes to symptoms, there was actually a lot of information about specific foods to fight Parkinson's symptoms. This is the first time I've heard anyone talk about this in the Parkinson's world. So addressing motor symptoms with nutrition. Number 1, so the best evidence for a Parkinson's symptom that is improved with food is actually the symptom of bradykinesia. Okay, so bradykinesia is that slow movement. It makes your steps short and small. The foods that help with that are colorful fruits, colorful veggies, red wine, and mulberries. And what's found in those is something called anthocyanins, which reduces inflammation and oxidative stress. You also, to help with bradykinesia, can increase your intake of selenium, which is found in Brazil nuts, crab, poultry, and fish. So Brazil nuts are also a little bit high in, I'm not sure the compound, but you're not supposed to eat more than 1 or 2 of them in a day. So Brazil nuts to help with selenium, just 1 or 2 in a day. Don't eat 5 or 6. I'll have to get back to you on what else is in Brazil nuts. But that selenium found in Brazil nuts can help with bradykinesia. Okay, so the next symptom helped by nutrition is gait. So there's a specific microbe in your gut called Provatella bacterides. Say that 10 times fast. And when you have an imbalance of this microbe in your gut, it actually has shown to worsen your gait. So they say Parkinson's starts in your gut. Gait disturbances start in your gut. So in order to help improve or increase these microbes in your gut, you want to feed it fiber. And the fiber can be found in nuts, seeds, vegetables, and they even said meat broth, actually. So bone broth, if you just Google how do I make bone broth, you'll find a way to make it really cheap and easy, and it is wonderful for your gut in so many ways. And your skin, helps with cellulite, helps with all these great things. So that is to help with gait. Next up, foods to help with tremor. And so this was a great topic, especially for Portland, considering that marijuana is legal here, recreational and medicinal. They actually said that cannabinoids help reduce essential and Parkinson's tremors. So I think there are only maybe 4 states that have approved it recreationally, but if you're one of the states that maybe medicinally, that can be something that you could look into. Also, B12 helps with tremor, and you can get B12 from good sources of eggs, high-quality meat, make sure it's organic and grass-fed, high-quality poultry, and oysters. So again, for tremor, it's cannabinoids or, medicinal marijuana and B12. Okay, so those are our motor symptoms helped by nutrition. That was the coolest thing. I haven't had this specificity anywhere except for here, so that's really awesome. Okay, addressing non-motor symptoms. Now, these non-motor symptoms, as you might know, are the ones that we can't really see. They're the depression, the anxiety, the fatigue, the pain, all of these things, and cognitive impairment. All of these things are caused by higher levels of inflammation in our body. It's not the only factor, but it's a huge contributing factor to these symptoms. So if you feel like you have cognitive impairment, depression, anxiety, fatigue, or pain, listen up. So you want to be focusing on getting antioxidants and anti-inflammatory foods. Okay, so I'm sorry if you keep losing me. It doesn't tell me that you are. But I'm just going to keep powering forward here. So antioxidants, you want to get vitamin D, vitamin C, and vitamin A. You really want to consume a lot of berries, colorful berries, tomatoes, and citrus, and supplementing with CoQ10, glutathione, spirulina, and ginseng. So those are all antioxidant foods, supplements, and vitamins. And you want to see if you can find these in whole sources of foods, not just supplementing and taking a bunch more pills, finding these in foods and working them into your daily life. And then we focus on anti-inflammation foods. So 2 groups here are healthy fats, the short-chain fatty acids and ALA, really, they were inversely associated with the development of Parkinson's. And so you really want to be incorporating so many healthy fats and oils. Now, you want to avoid vegetable oil, even though it says it's vegetable, it's not actually plant-based. Well, it is, but vegetable oil is really inflammatory. So the oils you want to focus on are olive oils, avocado oils, maybe hazelnut oil, and you want to avoid vegetable oil, soy oil, and because the lower quality oils actually increase your inflammation. So we can talk about that a little bit more later down the line. Coconut oil is also a really great oil to put into your diet. And then we talked about the other anti-inflammation food. We have fats and then vegetables. Green leafy vegetables, anything green put in your body, it helps bring your inflammation levels down like 18 notches. Okay, so I see we've got Surreal. Hi there. Sharon said we lost you. Sorry. Okay. All right. We're moving on. You guys doing good? Okay. Okay, so the next part of her talk, the end of her talk, was talking about, we just talked about all these foods to include, and now we want to talk about the ones to avoid. So at the risk of, losing some of you and you logging off and saying, I never want to hear from her again, I'm going to power through the 3 foods you want to avoid, okay? High fructose corn syrup, high fructose corn syrup. There was actually, I didn't know this, there was actually a 2009 study where they found that they actually use mercury to process high fructose corn syrup. And so when you eat high fructose corn syrup in your mustard or your canned vegetables or your, they might not, canned fruits, your sweets of any kind, you're actually eating mercury because that's what they use to process high fructose corn syrup, which was news to me. So mercury is the last thing you want in your brain. So you got to cut that stuff out. So we've got rid of high fructose corn syrup, we got rid of sugar. And what sugar does is it spikes your blood glucose, which further increases inflammation and then starts that crescendo effect. You have more cytokines, your body starts to feel malaise, fatigue, your symptoms get worse. So you want to dump the sugar so your blood glucose can come back down. And you can replace it with stevia, which is a natural plant-based sweetener. And you want to avoid Splenda because that is almost as bad as everything else we're talking about here. And then the third food to avoid are trans fats. So trans fats are predominantly found in fried foods. So frying your foods in anything, French fries, potato chips, anything deep fried, more than likely has trans fats in it. Crisco, shortening, really lots of trans fats in there. Okay, so that was foods to include and foods to avoid. And that was the middle speaker. Our last speaker, he is someone that I'm going to keep an eye on. His name is Dr. John Duda, D-U-D-A. He's out of the Philadelphia VA Medical Center. And he was talking a lot about food as medicine. And this is the first time I've heard a physician at a major conference come out and say, your food matters. I know your physician tells you that your food might not matter, but it matters. And this is the future of Parkinson's treatment, is nutrition. The house was packed. People really want to know what they can do. You're obviously tuning in because you want to know what you can do. So he strongly believes in a plant-based whole food diet that is very similar to the Mediterranean diet, where you have a lot of fish, healthy oils, some poultry, lentils, lots and lots and lots of vegetables, and you're avoiding things like low quality meat, butter, lots of the heavy fat laden. I love butter, grass-fed butter. So you want to make sure that if you're eating protein, it's in a smaller amount and it's really high quality. So he was talking about why plants are good for us. And plants actually contain 10,000 phytochemicals, which are the chemicals that plants use to protect themselves from their environment. So if you think about it, when you eat a plant, the things that are found in plants are protecting them from the environment. So when you eat them and you process all those chemicals, they go into your cells to help you protect yourself from the environment. So the more phytochemicals, the more protective chemicals you can get in your diet, the more protected every cell in your body is going to be, and not just your brain. This type of Mediterranean plant-based diet is known to help with heart disease, prevent your risk of stroke, improve your diabetes, on and on and on and on. So many wonderful things of using a plant-based diet. Okay, so he wanted to also touch on the gut microbiome. Oh, my feet are asleep. Okay, so it's different, that your gut microbiome is different if you have Parkinson's. Your gut microbiome, by definition, is the composition of your microbiota in your gut. So your bacteria, all those things that get a really bad rap in traditional medicine. We want to kill all these germs. They're actually really, really good for you if they're in the right order in your gut. So people with Parkinson's typically have less bacteria, and less bacteria means that your gut can't build the lining in your stomach that it needs to protect you from all the invaders that come into your digestive tract. So if you eat more plants than animal proteins, and you tend to have more good bacteria in your gut, And there are significant associations between the consumption of the Mediterranean-based diet and an increased level of your fecal short-chain fatty acids and good bacteria, which are both really good things. So if you come away from this with anything about nutrition, it's to look into the Mediterranean-based diet, plant-based, whole food, healthy fats, high-quality sources of protein if you're going to do protein, but that should be backseat to really whole food sources. So that is kind of wrapping it up with nutrition. I hope you guys enjoyed that part because I know that nutrition doesn't get talked about a lot. If you have any questions, just put them in the comments and I can get to them there too. So we are moving on to depression and anxiety. Really uplifting discussion here. Oh, okay, Sharon says, on Food as Medicine, check out Dr. John McDougall's website and his books. Okay, perfect. I will do that. And everyone else too. Okay, hold on. My feet are really asleep. Okay, not very professional. All right, guys. Sorry. Okay. You ready for depression and anxiety? Let's talk about it. Okay. Hi, Bruce. Thank you. Okay, so first up to talk about depression and anxiety and Parkinson's was Daniel Weintraub, and he's a psychologist. He actually might be a psychiatrist, but anyway, he was talking about Robin Williams, actually. So some of you have asked me in the past about Robin Williams and Parkinson's and my thoughts about his Parkinson's and his suicide, and Dr. Weintraub talked about depression and how our awareness of it has increased since Robin Williams has passed away. And a lot of people want to know, what causes the depression in Parkinson's? Is it psychological? You've been diagnosed with a major chronic disease, and that's life-changing, for sure. So is that what factors into the depression? Or is it more a biological cause? Something in the Parkinson's brain is affected. The brain regions and the chemicals that are affected by Parkinson's are also responsible for the mood regulation. And I'm going to have to talk fast. My phone's about to die. But what they really find is that it's a combination of both. And there are also a big combination of things that we can do to help treat it. So depression, this is something really interesting. Depression and anxiety are the two most common non-motor symptoms that fluctuate with Parkinson's. So very similar to your motor symptoms that fluctuate throughout the day or over the course of a month, depression and anxiety are symptoms too that fluctuate. And if they are going up and down tremendously, you need to be discussing those with your doctor just as much as you're talking about your fluctuations in your motor symptoms. So I know that it can kind of get pushed underneath a rug, depression and anxiety, but you need to be bringing it up. Or if you're a caregiver and you notice this too, you need to be bringing it up to your motor or to your movement disorder specialist. So then we moved on to Albert Linteens, and he was talking about anxiety disorder, which I see a lot of anxiety in my practice. And he says that about 30% of patients actually have some type of anxiety disorder compared to about 10% in the general population. It might be generalized anxiety, it might be anxiety attacks, it might be agoraphobia or social anxiety. You don't want to go out in public. You feel like you're avoiding people, because you just don't want to go out into social situations. And if this is you and it's hitting home, this is something we need to talk about more, because anxiety can impact your symptoms significantly. I see this in my practice so often. The more anxiety you have, the more fluctuations you're going to have in your motor symptoms, the more freezing you will have, the more impaired your gait will be. And just your overall quality of life is much lower. So I'm sure that I just spiked your anxiety by telling you that having anxiety makes your symptoms worse. But there are a lot of things that we can do to help treat anxiety and Parkinson's. And unfortunately, there haven't been a lot of studies on Parkinson's and anxiety and non-pharmaceutical treatments. However, our third speaker, Roseanne Dobkins from Rutgers, talked all about the non-pharmaceutical management of depression and anxiety. Included cognitive behavioral therapy, or CBT. And if you've heard of CBT, just give me a thumbs up, because this is something that I don't think is talked about enough. And if you are having anxiety or depression or any type of mood disorders, you need to seek out a professional who can help you with this training, because it's a very powerful training. People have significant improvements in their depression. I see a few thumbs up. In their depression, their anxiety, their motor function, their cognition, all of their quality of life, because what cognitive behavioral therapy helps you do is it helps you modify the thoughts that are going on through your head, which affect your emotions and then affects your behavior. And so a lot of the time we have this constant kind of thoughts going in our head, like everyone will notice that I'm freezing, or I can't go out to dinner because my tremor's too bad, or all of these negative reoccurring thoughts. And what CBT therapy helps you do is identify those thoughts, kind of pause them, identify them, and ask yourself, is this really true? And if it isn't, replacing it with a thought that's a little bit more empowering. And this is a standard treatment and is really effective. The studies have shown for cognitive behavioral therapy, it can be a significant improvement in someone's quality of life. So I know that, seeing quote unquote a shrink can be a really have a negative connotation, but it can help you get your life back in a way that none of these other medications or treatments can really do. So I would just encourage you, if you're having any of those symptoms, or even if you don't have Parkinson's and you're watching this and you have issues with anxiety, cognitive behavioral therapy can really make a big difference in your life. So that being said, she also recommended you fill your life with joy and pleasure and meaning, and that's exactly what I'm doing today. You guys give me joy and pleasure and meaning, and I'm so happy to be serving you, and I love doing this and letting you guys know what I'm learning. I am happy to answer questions. I'm probably going to have to hop off because my phone's about to die. But if you are really digging these, I'm going to be back tomorrow, same time, 5:30 Pacific time, to talk to you guys more about what I learned here at the WPC. You can shoot me a message if you have some specific questions, and I'm super excited to announce that I'm going to do an online Parkinson's exercise program called the Booster Program that starts next Monday. I'm opening the doors for enrollment, bringing in about 300 to 350 people to do an online exercise program with me. We're going to help you build your strength, your stamina, your flexibility. We're going to support you the entire way. And I'm so excited to bring that to you guys, but that starts next week. If you want to be a part of that program, you can sign up to be on the wait list at invigoratept.com/booster, which is BOOSTER. And I'll put it in the notes here when I hop off. But I really appreciate you guys. I see so many thank yous coming in, Rhonda and Aideen and Debbie. You guys are so great. I'm happy to serve you guys. Thank you so much for tuning in. So until tomorrow, I hope you guys have a great evening, and I am going to go out and see some other PTs and network a little bit and maybe find that glass of wine somewhere. Okay, thanks guys. See ya.